Thank you so much, Dr. Pai. It's a privilege to be here. And thank you, Dr. Avinash, as well. So before we really dive into this entire qualitative way, they have given me a very large topic, so I'll try and do justice to that. So what I'm going to cover in this session will be in-depth interview, IDI, focus group discussion, FGD, how to write a method section, sampling and qualitative research, and a small introduction to mixed methods. So before we do a deep dive, I would like to mention three very simple but very important points in qualitative research. So in qualitative research, we're looking to understand, we're looking to explore, we want to make sense of what's happening. So we use very neutral language, like in your research questions or in your AIIMS, you need to use very neutral questions like, what do we understand? What do we aim to explore this idea, this phenomena, or we want to discover something, right? So these are the kind of terminologies that we use. Please avoid using quantitative terminologies like relate, impact, determinants. We are making a comparison. We don't use these. We don't even go into these areas. So this is something very important for you to understand. The second point is about personal identification. Generally, we say it's going to be confidential. Now, in qualitative, if you say it's going to be confidential, we are collecting their data and we are going to share their data. You cannot say this is going to be confidential. You have to very clearly say your personal information will be confidential, or we will keep you anonymous. So make that a very clear distinction when you're doing qualitative. And third, the people we are interacting with are our participants, not respondents as in qualitative. Why are they our participants? Because they are co-creators in our research work. We are sharing their entire understanding, their life experiences. They are sharing with us. They are co-creators and they are called participants, not respondents. Okay, so these are three simple but very important ideas in qualitative. Now we will deep dive into IDIs. Okay, so like Sir has already mentioned, in-depth interview allows us to collect a large amount of data about behavior, about people's attitude, about their perception, the way they think and understand certain phenomena or their life experiences. So it is both for the researcher and the participant who can explore. We are both exploring together. We are both deep diving together, right? It's a journey that we are taking together. So like Sir has also said, there is a lot of scope for changing of direction. As you are deep diving into this understanding, certain concepts will come out. Like for example, I am studying research and studying about capability-based research. But as I study this research, I found the concept or the construct of vulnerability coming up very strongly. It was not part of my framework. But then I said, this is important. It has come up with 3-4 people. Let me deep dive there. Let me take a small diversion and see the importance of vulnerability in leadership, how it strengthens, how it weakens, or how it helps them build capability, right? So it gives you a lot of scope for moving around. It's sort of scope for maybe taking a deviation, which is taboo in quantitative. You have to stick to your subject, right? Then it is an independent research method, and you can adopt multiple strategies in going forward. You can choose. So what is the research instrument, right, in in-depth interviews? You can use a structured or a semi-structured interview guide. So if it is ethnography, that is you're choosing a community or a group of people and you want to sort of get into that group and understand, then it can be very open. Or if it's a phenomenology as a paradigm, right? So we are definitely not using a questionnaire in qualitative. It is an interview guide. So basically it is guiding us in, okay, these are the possible questions or the possible outline that we can ask our participants. So it could be structured when you have a group of set questions, but of course, while you do the interview, someone is talking about something, you can't say, okay, stop, finish, now my next question. You can't do that. You have to have a flow, right? Semi-structured is when you have a broad guide, but you are free to sort of deviate. You are free to give probes. You pick up something important from them. Okay, come on, let's get more into that area. So semi-structured gives you much more flexibility, and structured, if you're just starting into quantitative, maybe that will help you do the transition. So like I said in the questionnaire, what you definitely do is you have a broad guideline. okay, I want these main 5 questions, and then you kind of give a probe. Suppose I am asking a particular leader, what is valuable to you? Now it's a little vague, no? So they'll ask me, what do you mean? Then you give them an understanding. What is it you mean? What exactly are you trying to get at? And they get an understanding. So you give them small probes, you give them small feelers, right? So this is the kind of ways you kind of structure your guide, and we'll talk more about that. Am I too fast? Okay. So if I'm too fast, please feel free to say slow down. It's too fast. I'm okay with that. Okay. So I will now talk about the interview guide order. Okay. How do you make an interview guide? You start with an introduction, because this is a one-to-one, right? You talk about yourself, you talk about your research, you talk about what are you going to do with this data, because people are going to share really personal things with you. You have to make them very comfortable, that how are you going to keep this data safe? So give that introduction, be very clear, be very transparent in what you're doing, right? And then the question came up about consent. So you also take consent for participation, and you take consent for recording, right? So consent can be taken in writing, consent can be taken orally and recorded, and consent could also be taken verbally, but you need to have some sort of record for consent. Bear in mind, if you're doing ethnographic research, you need consent from the gatekeeper. Suppose you're going to a community. The head of the community, you need to get consent also from them first. Then you go to, maybe if you're doing research in a family, you get consent from the head of the family. So you have to bear in mind there are various stages of consent that you need to take. Like, for example, if you're working with children, definitely you have consent of the parents. If you're working with children in school, you need consent of the principal of the school, then of the parent, and then of the child. So you need 3 stages of consent. Is that question clear, sir? Okay, and then, so this background is given to the participant, and then we start with the opening question. So this is just to build rapport, to make them comfortable, right? We have all been to barber's shop when they are little, comfortable. Then you start telling stories, no? You go to some comfortable area. So you need to get these people comfortable to talk. They have to trust you. They have to be comfortable in the atmosphere. And you build that by starting a conversation. So you can start with general demographic conversation. How old are you? What background do you come from? Or something like that. Maybe in the rural areas, people are more, happy to tell you their stories about their family. It may not be so in the urban areas today. They are a little, privacy is a very important factor. So you need to be very clear with the kind of audience you have. So this takes like an hourglass shape, very broad. Then you come to your prime questions about your research. So these are your key questions, maybe 4 or 5, not too many, right? So talk about your key questions then, and very important to use the language that is understandable by the interviewee. So for example, you might say, you may use the word pregnant, and a person from that will not understand what pregnant is. Like from the place that I come from, they say, are you in the family way? It's understood that that means pregnant, or you may say being with stomach. So use the local language, the local jargon that they are comfortable with, and they get the same idea that you have, okay? Don't use very medical terms. They are going to see stars. Use the local colloquial words. And after you've got your key data, and then you go to your closing question, when again you slowly disengage your participant. You engage your participant, you disengage your participant, you kind of thank them for their time, you give a summary, or you paraphrase what you have understood, or you summarize what you've understood, and things like that. You slowly go to the disengaging of the participant. So this is your basic structure for an interview guide. How do you prepare for an in-depth interview? So your interview guide is ready. Now you need to pilot it. Okay? Is it taking too long? Is it too short? Are you rushing the person? Is your introduction not satisfactory? So please look at all these things. Our piloting in qualitative is very different from quantitative, because here you're trying to see, is your data rich enough? Is the data answering all your research questions that you're asking, or you're not getting sufficient data? Then maybe you need to change your questions. You need to broaden your questions, right? So then you have to reflect on subjectivity. It's called researcher reflexivity. You are an individual and you are dealing with another individual. And we know, and in life, we always come with different perceptions, different understandings. Now, this is going to influence our research. Whether you like it or not, my perception of the other person, my perception of this topic is definitely going to influence what I am receiving, what I am understanding, what I am interpreting from that data. So be very, very transparent with yourself. You need to know where you stand on the subject. Are you very motivated, very excited? Then you'll interpret everything also like that. Or are you very negative about the subject? You're going to interpret everything like that. So be very transparent. Where are you on that subject? Okay? And then you look at power relation. So what is power relation? In any conversation we're having, there's always some sort of power. The person who's more senior, the person who has more authority, the person who has more knowledge is always in a higher power than you are. In any relationship, that any time we are talking, right, we are aware of it. The same thing happens in research. If I, as a doctor, am going to interview a patient, what is the power relation? The doctor will be in a higher power. Now, this can be adverse for your research. It could also be good or it can be bad. Why adverse? Patient feels, "Arey, Dr. Saab is saying something." No? And you get scared. The patient is scared. He's not open enough to share with you. Or he may think, "Arey, he's the doctor. He knows everything. I need not explain these things." And you will lose a lot of data because the patient thinks, he is already aware. Why should I explain it? He will know. And you're going to lose data, right? So you need to figure out how do you reduce this power balance. For example, when I was interviewing leaders, I was interviewing very senior leaders, C-suite leaders. They did not know my previous background, that I've also been in corporate. So they thought I'm an academician. She does not understand this jargon. She does not understand the way we do. So what did they do? They explained a lot to me. They gave me a lot of examples. It's like this and this happens, and I'll give you an example. I'll tell you about the story. So I got a lot of data, very rich data. I allowed them to feel that, I am in a lower power, because that gave me very rich data, right? They were explaining to me and they said, "See, you may not know this jargon. It means like this. It means like this." I was like, okay, yes, is it so? Okay. And I got a lot of data. So even though this power balance sometimes is negative and positive, you can use it to your benefit. So this is a very important concept that you need to keep in mind. It does not come up in quantitative. Where to conduct your interview, right? If you're talking about something very sensitive to the patient, you're interviewing a patient with AIDS maybe, or cancer. They don't want to be identified by the people. You need a secure room. You need a safe place, right? If it is something very sentimental or is going to cause pain or suffering, it would be ideal if you took them to an open area, a garden area, where you feel relaxed, you feel comfortable, and you're able to share and speak. So a right atmosphere is needed when you're interviewing the patient. Don't just take them in a busy hospital, just come sit on this chair and ask questions. It doesn't happen like that. We have to take a lot of time and empathy and understanding. Do you need to make appointments maybe? So think about that as well. How will you be seated? Enough space. The person should be comfortable. You should be able to watch the body language because, in qualitative, we also note down our understanding from the person's body language. How interested, how scared, is what they're saying and what they're feeling, is it matching? Why is it not matching? So body language needs to also be looked into. And lastly, it would be ideal if you had a recorder to record the interview and a notebook for you to write down your own notes, your observations. Something has struck you during the thing. You are not able to coordinate all these things. So record the interview, but also have your notebook and take down your points as things strike you or as some important point hits you. Have both. This notes is called field notes, and it is also used in your data. It's part of your data. Okay, conducting the interview session, like I said, is also very important. I'm a trained counselor, and so it was very easy for me to conduct the interviews. I felt I got a lot of rich data because a lot of social skills are involved. How you build a rapport with somebody, how you are making them comfortable. Are you empathetic in your understanding of them? So somebody is telling you some very sad story and you're just busy with that interview guide. Okay, what question I have to ask next? it immediately gives, you're not interested, you just want data. And that person is going to immediately clamp up. He's going to shut up or she's going to shut up. Then you're not going to get your data. Your body language. Are you bending forward? Are you interested? Are you genuinely interested? See, these social skills have to be developed, and probably you will need a session on social skills if you're doing interviewing or FGD. I think it is extremely important to have these social skills. Motivating them to talk. So there are various skills I've put there. We need not go into all of them. Okay, so with that, I've given you a brief introduction to IDI, and now we'll understand focus groups. Okay, so focus group discussion is a very interactive discussion between 5 to 7 or 8 people is an ideal number. You pre-select them, and it's led with a trained moderator, focusing on very specific set of issues. So you come with the clear agenda. These are the ideas we want to discuss. So this is what we want to talk about. So what is the aim is to get a very broad range of views. We're not talking about not going in depth, but here we're getting a broad range of views over a period of say 60 to 90 minutes. And you create an environment where participants feel comfortable and safe to express what they feel. So when do we use focus groups, right? When we want to explore a new topic. We don't have much background knowledge. We don't know what it's about. We want to get the feel from that particular group of people, that particular community maybe. So here we bring people to discuss their ideas, to get an understanding. These may be issues, these may be problems, these may be something that we need to work on. So when you're not very clear, you conduct a focus group to get an idea. Then to get a range of views. So you, for example, you may have a focus group with a doctor, with a nurse, with a patient, with a family member, and your paramedical and your social worker. You get a range of ideas within one, say, palliative care. How different people are viewing it and what are their different needs. So you get a range of ideas. Understanding a typical behavior or socio-cultural norm. For example, stigma. We did a stigma study with both cancer patients and patients having HIV and then newly diagnosed patients. So here you understand what is the stigma at different level with both the patient as well as the family member. Oh, I'm so sorry. Understanding a group process, okay? So for example, decision making. How do they take decision on whether to go for a treatment? Or how do they take a decision on whether to continue with something? Or maybe to go from allopathic to Ayurveda or yoga? How do they take these decisions? So understand the entire group process is also a good idea to have an FGD. And then finally, if you're doing a mixed methods research, then an FGD can be part of the research understanding. So developing your discussion guide is on the same lines of developing an IDI. So you have a list of topics that you would like to discuss, or you can even have a series of actual questions that you note down and used by the moderator to guide the discussion and keep it focused on the research topic. Because you know, when a group of people get together, you can start at Kanyakumari and you can reach Delhi. So you need to kind of keep your group on track. So you need to have that guideline. The outline of topics for the discussion guide is identified during your design cycle. So we can have both inductive and deductive approaches to guide the development. So inductive is what is coming out from your data, and deductive could be from your theoretical framework or from your conceptual framework. So let's look at how an FGD guide is developed. Again, you start with an opening question which kind of breaks the ice, all different people coming together in one setting. And then you have introductory questions, which is very broad. It's kind of to warm up the participants and get some sort of group rapport. You can ask some little difficult questions, which, little debate takes place. And then you move from that broadness to your specific, to your point of view, your specific questions. So you can have transition questions, right? Get into your key questions, maybe 2 or 3, not too many. And then again, go to a closing question where you summarize everybody's view, or you ask them after you've had a discussion, now what do you have a change of thought? Do you have a new understanding? So you can also get that feedback from the group, because when people discuss in a group, there can be new knowledge that comes. So that could be your closing question, or it could also be a summary of everybody's views. So this is pictorially how a group discussion will look. Please avoid the first one where the moderator is asking all the questions and everyone is directing the answer to the moderator. So it is not a question interview session. You are encouraging group discussion, right? So when the group is discussing, again, you'll see there will be power dynamics, there will be group dynamics that takes place, and you want to understand that as well for your particular research question. So encourage the idea on the right-hand side where there is interactivity. You are asking the question, no doubt, but there is interaction that becomes much more rich. So pilot testing of IDI and FGD. What are the ideas that you need to look at when you're piloting? Was sufficient information given in the introduction of the group discussion? Are the people there understanding what you're talking about? Why are we here to discuss it? They have to be very clear about it. Did they get sufficient information? Are they still not sure what they're doing there? So that has to be clear, right? Were all the questions understood as intended? Did they understand it differently? Do you need to change your questions? Do you need to explain it better, perhaps? Do any questions need to be reworded to improve your clarity? So you may have to change your language. Maybe the terminologies you're using is too scientific, something simpler for people to understand. Does the structure of the guide work well? So there should be a flow. It shouldn't be something that's breaking. One should lead to the other. That flow needs to be there, right? Will the information gained help to answer your research question? This is most important. If the data you're getting is all over the place and you're not really focusing on what the question is, it's not going to be useful. So at the end of the day, the research question needs to be answered. Will the information, yes. So is the guide long enough or not too long enough? Ideally, 60 to 90 minutes is the best. More than that is too long, and less than that may be too short. Data will not be rich enough. So to give you a little comparison, IDI versus FGD, in the in-depth interview, you're looking at narratives, like Dr. Avinash has already explained, and personal stories, right? In FGDs, you are looking at opinions, because there will be a tendency in your group discussion for people to speak in the third party, for people to represent their family or their community. They will generally not say, I feel, it's we feel, it is said. You get that third party kind of, so it's more an opinion, and stories also. About others. It could be themselves, but they will represent it as others. So here you have personal subjectivity. In an FGD, you will have your group subjectivity. So you should be able to differentiate the two. Here you will have an individual or a social context, and there you will have a more community context or the community point of view. I love qualitative research for the simple and the main reason that it's very creative and it's very innovative. Being a creative person, I'm able to understand, or I feel close to this sort of methodology, because in addition to those main topics, main methods, you have also other sub ways of looking at it, like photo voice. What is photo voice? For example, you're doing quality of life, you want to understand, you tell your participants, take a picture every day of the most important thing that you're doing, thing that you like. Now, this picture, when they come to you, you say, okay, speak about this picture. And you will see amazing insights that come out from it. If you just sit and ask, okay, what is important in your life, they may have to think, no? But you say over a couple of days, over the month, take a picture a day. Now, everybody has a mobile phone, it's not difficult. Take a picture a day of something classic of that day, something that represents the day, something that tells you about your well-being, whatever. Somebody will take a picture of going to the temple. Somebody will take a picture of a good meal. Somebody will take a picture of family time. All this is quality of life. Then you say, come on, explain, share what this picture tells you. And you will get very rich data, beautiful data that comes out of it. The other thing is storytelling with objects. I attended a session on this storytelling with objects, and I thought to myself, okay, this is like photo voice. What is so new or different about it? Then the facilitator told us, come on, you pair in groups, and you look at your room or your house. You identify one object that is dormant. That means we all have a lot of things in our house that we don't use for the last 10 years, but we don't throw them out also. So I was just looking around my room, what is it that I have for 10 years and I've not used? Then I thought books. I have plenty of books. And I have boxes of books. And sometimes I've not opened those boxes for 10 or 20 years. I have books from my PG, from my social work days. I have books. And I thought to myself, I don't know what struck me, but I said, okay, I'm going to take books. And then when we came back to that pair, and then I was thinking, but I don't know why I keep all these books. So the other person encouraged me to, dig into that. And then I realized the dormant object is equal to my subconscious. In my subconscious, I have a yearning for academics, for learning. And I was in management in a hospitality, and I changed my career at the age of 38 and started from scratch in academy. So I did not realize that this yearning was there. And I did not realize the books that I'm collecting is significant of this yearning. So you get very deep insights, very deep that I was not aware of. And the other person that I was talking to, he said he had a small object on his table. It was given to him when his mother passed away. He said, I had it for 20 years. Maybe I don't look at it often, but it is there. And then he was able to tell the connection with his mother and that object. So it is the insight you get in these kind of programs is amazing. It's phenomenal, right? So this little object can bring thoughts and memories and make a lot of connections for the people. So tell them, bring this object that is most important to you and speak about it. So these are also ways that you facilitate the interviewee on sharing more deep knowledge about a particular program. Then you have journal writing, where you can encourage them to write every day their thoughts, and then you bring the journal and you analyze the data. You can use social media conversations, you can use Twitter chatter, you can use music, you can use observation. Observation is the main tool, but I've put it here because it is not part of my outline. So both covert and overt observation can be, used. So we now, is any doubt in this part? You want to ask anything? Then we move to how to write a method section. Yeah? Okay. So how to write a method section? So broadly, these are the areas that you have to cover in a methods. These are the subheadings: study setting and design, case and participation selection, which is more like sampling, participant recruitment, data collection, data analysis, the researcher's positionality and reflexivity, and ethics. So in your study setting and research design, I will broadly tell you what to cover. So you have to talk about the data, where the data was collected, explain what are the activities that takes place in that site, in that location, and you have to justify the choice of the location. Why have you chosen this? And why do you think this is suitable for your research? Everything needs to be justified in qualitative, because only then we can have rigor and we can have transparency and validity of your data. Second is, were you having any collaborators and what were their involvement? It has to be spelled out. Then you explain why have you chosen qualitative as your approach. Are you searching for some in-depth analysis? Are you searching to explore something? So you talk about that. And what is the design that you have chosen? Again, you justify how suitable it is for your research. Why could quantitative not be taken instead? Why have you chosen this? So everything needs to be justified. And then very important is you talk about the research philosophy, because these are experiential, these are understandings. Research philosophy becomes very important. So you explain your ontological and epistemological stance. When I was first introduced to this, it took me a few weeks to say the word ontology and epistemology. It took me a few more weeks to understand what is what and the difference between the two. And then another few more times to explain it to somebody else. So I feel you, I understand you, I'm totally there. But this becomes very important because this tells you what is your world view. How do you view the world? And this is definitely going to influence your data. It's going to influence your research. So then you ask how this has influenced your choice of research approach, your research design, your research methods, right? So we'll talk a little more about that for those of you to whom it is new. So ontology is basically the study of reality. Does reality exist? Whether I am there or not, does it exist? Or do I create reality? Or is my interaction with you creating reality? That means your reality is different, my reality is different, somebody else's reality different. So we have different realities. Then we look at constructivism, or we look at social constructionism, right? So then we look at epistemology. What is epistemology? The hows and whys, the questions, how is it possible? Why is it possible? We are trying to understand how this knowledge is created. So how this knowledge can be acquired, how this knowledge claims can be justified, right? So we look at an interpretivist approach. So it is very important for you to sort of explore these areas, because this is the basis of why you are choosing a particular research design and approach. And it's also going to give you a strong foundation that it is a suitable approach to take. The axology talks about the researcher's position, your values, your beliefs, because again, that is going to influence your research. And then finally, the methodology is the process and the approach of the research. So when I was struggling with these terminologies, I came across this book and I put it down there, A Short Guide to Ontology and Epistemology, Why Everyone Should Be a Critical Realist by Tom Fryer. I suggest that you read it. He makes it very simple, very funny, and he deconstructs these terms beautifully. I mean, it's very basic, of course. You can then read, hi-fi books, but to just understand these terminologies and grasp it and get a hang of the subject, this is a fantastic book to read. So please do get it. It's available online, or I could send the PDF to Sir and he can distribute it. It really made my life easy because I was able to grasp those concepts. But these are very important concepts, and it needs to be explained in your methods. We look at now recruitment. How are we going to identify who is our target population for my research? Who is this group that I'm going to contact, right? So what are your strategies of locating these participants? Will you make a flyer explaining this is my study, those of you who are interested, please come? How are you going to distribute this flyer? Are you going to put it in the hospital walls? Are you going to give it to particular people? Are you going to send emails out perhaps? Are you going to use social media? Today everybody's on social media. It is so easy to reach. Are you going to use referrals, word of mouth, to build a pool of your participants? Will you contact organizations or associations or clubs or particular therapy groups or, where people gather? So you also have to explain this. How are you going to recruit your participants? Then case and participant selection. So generally we use the purposive method, but convenience sampling is used, where it's you use the population that is convenient for you to reach out to, or self-selection, where people volunteer to come and give you data on a particular subject. Then you can use snowballing. Snowballing is also a very interesting sampling method, wherein you want to reach out to a very specific target audience that is not visibly known to you. For example, people who are addicts maybe, or prostitutes, or people with HIV. How are you going to find this particular group when they are not going to advertise to everybody they are? But what happens with these particular target groups, they will always know other people who are in this similar group. So you contact one and you say, can you refer me to another one? Then it goes to another one. You ask that person, can you refer me to another one? So that is called snowballing. It snowballs into a particular number of people, right? So these are for very target, very focused kind of groups, which are, you don't know, where to find them. And then you have purposive sampling, where you have a very clear inclusion criteria. I want this particular kind of people. They have to be 8, 2, 3, 4. So you then have this inclusion and exclusion criteria, and you follow it to the T. So that is purposive sampling, because you want a very specific data from a very specific group of people. So in purposive sampling, you also can have quota sampling. For example, when I'm looking at leaders, I looked at middle level leaders, I looked at senior level leaders, I looked at male leaders, I looked at female leaders. So I had 4 quotas there. Now, when you have quota sampling, then your sampling becomes much larger and then very much more difficult to deal with. Is that clear? Shall I move? Okay, so data collection methods should be described in detail in your method section. If you have used observation, you have to explain what are you observing, what resources or equipment will be used for your recording the observation, who is the person who is observing, is that person a trained observer, do they have some training in this? Because observing is not that simple. There are so many things that get involved in observation. If you're using in-depth interviews, you need to explain how will the prompt guide or interview schedule, interview guide be developed, who is conducting the interview, are you doing it by phone or by person or online, and how are the interviews being recorded. If it's focus group, you need to say who is leading the focus group and how are the focus groups being recorded. Unlike an interview where you can record it, in a focus group, it's going to be a royal mess if you're going to just record it. So you need to have a separate person who's transcribing. You need to have a separate person who's moderating. Maybe you need to have 2 or 3 transcribers, each one transcribing each person's words. And somebody just looking at body language. It becomes so much more difficult. So that has to be recorded. The more detail we take, the more validity our research gets. In the data collection, you need to specify, are you using semi-structured or structured interview discussion guide, and why? Justify. Was it observation? How did you conduct it? Was it face-to-face, online, over the telephone? Why? Everything has a why. You have to justify. Was it recorded? Did you transcribe it? Generally, they say transcribe within 48 hours because then you forget what has happened when you're transcribing, so you need to do it very soon. Are you back translating it in case of language change? For example, somebody has given me the interview in Hindi, and I am writing it in English. So I translate it in English. Then a total different person has to back translate it from English to Hindi and check if the interview and what the person has translated is matching, because in that translation, you can lose out a lot of important data and understanding. So back translation becomes important for validity. Do you have field notes, like I was telling you earlier, mention memos, journal entries, all this is used as data. What is the duration of your IDI in FGD or your observation, if it's ethnographic study, your stay in that particular village or community or group. Then you talk about the coding process. How have you de-identified your participants to keep their anonymity? How have you stored your data? Is it transferred? Is it password protected? All these little minute things have to be mentioned. Have you done manual coding? Have you used a software? Which version? Which one? Why? Sorry, it's pretty heavy, I think. Is it? But they've given me this topic and I wanted to make sense of it. Okay. Then you talk about your data analysis. I will not go into the details because somebody is already taking a session, but then you talk about which type of analysis you're using. Why is that analysis appropriate to my particular study? Okay. Very important, then you talk also about your researcher's positionality and reflexivity. What is your position? How do you position yourself in the research? Are you positioning yourself as an insider or an outsider? So I told you in the research which I was doing with leaders, I was an outsider. But sometimes the way we position ourselves can also be an insider. And the people can view us as an outsider. There are a lot of dynamics that takes place, in this. It's not that simple. It's complicated. So this has to be stated in your research. So the person who's reading your research can also understand, this person has looked at it from this point of view. This researcher has looked at it from that point of view. That is why this result. They should be able to deconstruct what you have done based on your explanation, right? So insider view is called the emic view, and outsider view is called the etic view. Then you also talk about the power relation, which I've explained in the earlier slide. Which power position you have taken, which power position the interview was in. Has that made an influence on your research? Because that will come in your limitation. Finally, you conclude your methods section with ethics. So you have to state here the participation information form. Have you given, thank you. Have you given all the information you need to the participant? Are they very clear about what you're doing and what you're collecting and what you're doing with their data? Have you got their consent forms and the process? Then whatever is your ethics approval that needs to be got from your institution, the IRB or ethics committee, what is the process, what is your ethics approval number, it has to be stated in your paper. Then you may require CTRI clearance will have to be got. Depending on the type of research, you may need a clearance from ICMR. If you're collaborating with a foreign researcher or you're getting foreign funds, then HMSC clearance will have to be got, and this takes a really good time. So you have to be well prepared for it. And then if you have any conflict of interest, you need to state that. Excuse me. Now we go to a very interesting topic of sampling in qualitative research, which our dear quantitative researchers will never understand. because I did my protocol presentation, and it was like almost had a fight with the people there, and they were not able to understand why I'm having such a small sample. And they were asking, but how long will you take for your interview? I have no idea. It's qualitative. I don't know how long they're going to speak to me. No, you should have an average idea. You should have a rough estimate. I was at loss of words how to tell the person. I said, madam, you may take 15 minutes to tell me your story. The other person may take 2 hours. I have no idea. So it was a difficult situation when I started at qualitative because it's very difficult. They're very different from quantitative. So defining a sample size a priori becomes difficult, I would say. But it depends on how homogeneous your participants are. The more homogeneous they are, maybe you can have a smaller sample. And if they're not homogeneous, you will definitely need to increase your sample size. People generally say depends on saturation of data. That again is a very tricky subject because I did like 20 people and I thought I had saturation. Then I said, let's do a few more. After doing 3 more, then I got an outlier. I said, suppose I'd stopped at 20, I would not have had this rich data. So this is a little tricky, but generally what they mean by saturation of data is more or less you're getting the same responses from the participants and there's no new data to be found. So because in qualitative, we are looking at richness of data. We are looking at variety of views. So when you feel that variety of views is not coming, it's getting restricted now, nothing new is coming, that is more or less you can say saturation of data has been obtained and you can stop with the number of samples that you are taking. So if you're giving a protocol, you have to mention some sample. So what you do is you say, I'll take a minimum number of this much. So they allow you then to go forward or stop at the minimum, right? So if you're doing a thematic analysis, roughly 20 to 30 is a safe number to take. You would generally get saturation within that amount. If you're going for interpretive phenomenological analysis, which is really digging deep, more than 6 is driving you mad. But you can take a larger number, but then you cannot go case-wise. You cannot interpret each person. You'll have to take topics and look at all the cases. So that's a different, that's a whole new subject together. But since it's an introduction, I'm just giving an understanding. 6 to 15 people is an ideal size. If it's thematic analysis, which is fairly common, 20 to 30 people is also a pretty good size. So this is Saunders' onion. He gives you a very large view on the different philosophies you can take, the different approaches you can take, inductive or deductive, and then the strategies based on those philosophies and approaches. What are your choices? You can go for mono, multi-method or mixed methods. What is the time horizon? You want to do a cross-sectional or longitudinal, and then you can, then accordingly you can select data collection and data analysis. This again is a topic by itself and I will not jump in, but just to give you an idea, you can read up Saunders. He's a very famous, he's got an entire book on that. So that's just to introduce you to the concept. All right, so we're coming to the end of the topic. I'm very proud of myself. I've kept within the time, but then I ate some of your time. I think I got it earlier. So mixed methods research is when you do generally a combination of qualitative and quantitative, right? So basically, when you need to answer the research question, it all depends on the type of research question that's driving your study. And then you decide, to answer this question, I need qualitative, or I need quantitative, or I need mixed, which will make it more rich. So if you want to generalize the finding, then qualitative research may not really suit the budget. Because it's very difficult to generalize because you're taking ideas, you're taking thoughts, you're taking life experiences. You cannot generalize this to a large population, right? So in a mixed methods research, this comparative weakness is mitigated by the comparative strength of the sample size. So then you can go for a mixed methods. What is the contextualization? So mixing methods allows you to put findings in the context and get a richer detail to your conclusions. So to put meat on the bones, they say, right? So you understand it and then you get more data on that. And then finally, for credibility or to triangulate your data, you use the mixed methods. So you try qualitative, you try quantitative, and you see if it's really meeting at the same point. And then you can triangulate it or you can give more credibility to what your findings are. Okay, so the different types of mixed methods. You have convergent parallel. So what happens here is you collect qualitative and quantitative at the same time. You go parallelly, okay? And then you analyze them separately, and after both an analysis is complete, you compare your results and you can draw your overall conclusions. So you don't mix, you don't get influenced from one to the other. There's no influence. They're done parallelly, analyzed separately, and then you see the results and you make a comparison whether yes, it's making sense, or no, it's difficult, it's different, whatever. The second is explanatory sequential. So explanatory comes first, which means your quantitative data collection analysis occurs first and allows followed by a qualitative data analysis. So you may do a quantitative data and you may get certain hypotheses, but you would like to know why. You want to know how. Then you do qualitative. Or you can go for an exploratory sequential where the qualitative data analysis is done first. So the how and why you understand, you find a hypothesis and then you test it quantitatively, okay? So you can use this design to first explore the initial questions to develop a hypothesis, and then you can use the quantitative data to test or confirm if your qualitative findings were in fact, generalized to the larger population. And my last topic is, was also given when you're reviewing a qualitative paper, what are the guidelines? So these are some of the guidelines a particular journal gives when they review a paper that you submit, but every journal is different and will have their own methods and own priorities. But just to give you an understanding, these are the questions that they will ask a reviewer. Does your article bring a definite new contribution in the area of study? So that depends on your research gap. The study proceeds from a sound theoretical foundation. The literature references are comprehensive and appropriately current. The literature is critically reviewed. The research problem is clearly outlined. When it comes to methods, whether you have described your methods adequately, like I told you, it's very elaborate. It will depend on the number of words of each journal, of course. The execution and implementation, is it appropriate? Is the results correctly interpreted and linked back to theory or literature? And if the data is available, is there sufficient information for the analysis to be repeated? Then is your title appropriate? The overall presentation is logical and systematic. Is it clearly spelled out? The results, if they surprising or not surprising, because everybody wants, they don't want mundane research. They want something mind-blowing, cutting edge, that kind of stuff. Then the format and referencing, does it conform to the requirements of the particular journal? Then what happens is they will tell the review to summarize the most important reasons why this should be published or this should not be published. So then they will come to their own decisions. So yes, I'm done.